Okay, so for your cancer chemotherapy, syempre these are drugs that are used for cancer patients. And so when you say chemotherapy, this is the use of the different chemical compounds for the treatment of infectious diseases by killing or inhibiting the growth of the organism without damaging the host tissues or cells. So your chemo drugs or your anti-neoplastic drugs are often used as the primary means for the treatment to cure some of your malignancies like your testicular cancer, leukemias, and lymphomas. So, yung mga type ng malignancies na to, usually, ang ginagamit lang natin is your chemotherapy. So, no need to use your radiotherapy or surgical procedures. Pero sometimes, your cancer drugs or your chemotherapy can be used in conjunction with surgery or radiation. So, ginagawa ito in order for us to prevent the relapse or recurrence of the different malignancies. And in some settings, for palliative settings. So, para makaprovide ng palliative care sa patients. So, the goal of your chemotherapy is to eradicate every viable tumor cells, take note, without significantly damaging your normal host tissues. Kasi your chemotherapy kasi not only kills your cancer cells but also the different normal cells in our body. So, ang goal natin talaga for chemotherapy is only to eradicate the tumor cells as much as possible, no? So, the anti-neoplastic regimens will include the following. You have your traditional chemotherapeutic drugs. You have your biologic response modifiers, novel targeted agents, hormonal therapies, and agents used specifically to protect the patient from the toxic effects of your chemo drugs. So for your classic chemo agents or chemotherapy agents, these are not tumor cell specific. So most of your cancer drugs or chemo drugs kills all cells actively undergoing cell division. So ang pinapatay niya is all cells undergoing or actively cell dividing cells. So it will result now to an unintended destruction of the different normal host cells. Kaya ang nangyayari sa mga, kung mapapansin nyo, yung mga cancer patients natin, talagang bumababa yung immune system nila since nata-target din ng chemo drugs nyo yung mga normal host cells. So that's for the classic chemo agent. So ang mode of action of your chemo drugs is to kill or impair the susceptible tumor cells by blocking a drug-sensitive biochemical or metabolic pathway. So, examples nito, you have your cell cycle phase, specific anti-metabolites. So, ibig sabihin, cell cycle phase, specific anti-metabolites, it will target a certain cell cycle phase in order to prevent the replication or the division of that type of cell. So, for your alkylating agents naman, it acts by interfering with the nucleic acid function and protein production throughout the entire cell cycle division. So, therefore, it will now render your cells ineffective na in proliferating or dividing. So, ito yung cell cycle phase natin. So, for the cell cycle phase of division, syempre you have your S phase, your G1 phase, G2 phase, and your M phase. So, ito yung mga possible targets ng different chemo drugs. So, nandito na naka-indicate na yung mga important chemo drugs that targets a specific phase of your cell cycle. So, for example, itong mga vinca alkaloids, it targets your M phase of the cell division. So, yan. Very important for you to familiarize yourself sa mga drugs na and kung ano yung tina-target nilang phase of your cell division. Yan. For the action naman of inhibiting the different pathways of your nucleic acids and proteins, ito yung example na natin. So, familiarize yourselves lang sa mga to. Hindi naman siya very important. Yan. So, for the principles that govern the useful application of your cancer chemo, it will include the following. So, first, the tumor must be susceptible to the drug selected for treatment. So, dapat susceptible yung tumor in order for the tumor to react with your selected chemo drug. So, second, the drug or the method of administration must not have intolerable local or systemic toxicity. So, ang goal nga natin is to only target the tumor cells. So third, the drugs must be present in sufficient concentration. So dapat sufficient yung concentration ng chemo drugs in order for that drug to be able to inhibit a certain period of the cell cycle of division. So para ma-inhibit yung division ng cells natin. So dapat sufficient yung concentration ng chemo drug. So fourth, the cancer chemo is more effective when the tumor mass is small than when the tumor cell burden is high. So ang reason dito is that because a larger fraction of the tumor cell population is undergoing active division in small tumor mass and that the blood supply is more plentiful, allowing for increased sensitivity and delivery of the drug. So in other words, kapag maliit yung tumor natin, mas maraming cells na nag-undergo ng active replication. And ang target ng chemo drugs natin will be cells that are actively replicating. So sa small tumors, mas maraming tumor cells, mas maraming matatarget yung chemo drug. And syempre, pag maliit yung tumor cell, mas maraming blood supply, then increased yung delivery ng drug natin dun sa target nating organ or tumor. So for fifth, the anti-cancer drugs kill cells according to the first order kinetics. So familiar na kayo dyan sa first order kinetics. And six, the administration of combination of anti-neoplastic drugs takes advantage of the different mechanisms of action. So sometimes kapag bibigay ng chemo drug sa isang cancer patient, multiple drugs yung binibigay na drug in order for that drug to be effective in targeting the tumor cells. So gumagamit ng multiple drugs with different mechanisms of action for it to be effective in terminating the tumor cells. And last, cancer cells may build up resistance to a previously effective drug. So prone din yung cancer cells natin na mag-develop ng resistance against the different chemo drugs. Kaya sometimes gumagamit ng immunotherapy. So yung immunotherapy, it will boost the immune system of the patient in order for the normal cells or the natural killer cells of our body that can target tumor cells to be active. So tutulong yung mismong immune system natin in order for our immune system to eliminate the tumor cells. So combination therapy. So for the different chemotherapeutic agents, hindi na tayo magpo-focus isa-isa sa mga chemo drugs since napakadami nun. So familiarize yourselves lang kung anong agent sila. And syempre yung important na mode of action and yung in general saan sila ginagamit. For example, kung leukemia ba, gano'n. So gano'n lang. So for your anti-neoplastic alkylating agents, the mode of action of these agents is the formation of your alkyl radicals. So formation of alkyl radicals will now form covalent linkages with your nucleophilic moieties. So mangyayari dito, magkakaroon ng formation of the different cross-linking strands of your DNA. So pag nagkaroon ng cross-linking strands of your DNA, it will now hinder cell division. So magsa-stop yung replication ng tumor cells. So for better na understanding of the mode of action of your anti-neoplastic alkylating agents, you may watch this video. Itong link na to. Yeah. So for the alkylating agents, this is composed of 6 major chemical classes. You have your nitrogen mustards, alkyl sulfonates, ethylenamines, triazines, tetrazines, and your nitrosureas. Yan. So, ito yung important na table. Makikita siya sa reference material nyo by Dowd. So, naka-indicate na dyan yung class ng agent, ano yung mga different drugs under these agents, ano yung name nila, adverse effects, and syempre yung important sa field niyo is yung the development of your stomatitis. So, ano yung mga drugs dito na prone na mag-develop ng stomatitis sa mga patients. So, important na i-take note nyo itong tables na ito. Yan. So, for stomatitis, that's an inflammation of the mucous lining of the mouth, which may involve the cheeks, the gums, the tongue, lips, roof, or floor of the mouth. So the word stomatitis literally means inflammation of the mouth. So for cancer patients kasi, most of your chemo drugs will put them at risk for the development of your stomatitis. So pwedeng magkaroon kayo ng patients or cancer patients na pupunta sa clinic nyo for dental check-up dahil sa inflammation dun sa mucous lining of their mouth. So pwedeng yung i-explain sa kanila na this is a side effect of their chemo drug. And syempre, kayo na yung mag-i-instruct ng mga important na remedies natin for these patients. So for antimetabolites bear a marked structural resemblance to your folic acid and to your purine and pyrimidine bases. So your folic acid, purine, and pyrimidine bases are very important for the synthesis of your DNA, RNA, and certain coenzymes. So, ang mode of action ng antimetabolites is that they exert their major effects during the S phase of the cell cycle. So, S phase, S stands now for your synthesis of your DNA. So, this activity will now interfere with the growth of your rapidly proliferating cells throughout the body. So, magkakaroon din siya ng effect sa bone marrow, germinal cells, hair follicles, and lining of your gastrointestinal tract. Since yung parts na ito will have rapidly proliferating cells. So, ang mangyayari, not only the tumor cells will be affected, but also cells in this organ. So, kaya mapapansin, most of your cancer patients nagkakaroon ng hair loss. Yan. Hair loss since sa hair follicles natin, meron tayong rapidly proliferating cells and syempre sa bone marrow. Kaya ang cancer patient, most of your cancer patients will manifest with anemia. Yan. So, ang side effect ng antimetabolites natin will be your oral mucosal toxicity. So, this is a prominent feature of your antimetabolites. So, meron din grading yan, yung oral toxicity scale natin for our chemo drugs. So, may grading sila depending on the severity of the oral lesion. So, there are 3 classes of antimetabolites. You have your folic acid analogs, purine analogs, and your pyrimidine analogs. So, for the detailed mode of action, please watch this video na. So, again, ang important dito will be the table. So, ito yung table na important. Andyan na yung class, your folic acid analogs, purine analogs, and pyrimidine analogs, anong drugs, and syempre, yung adverse effects. And very important, again, is yung sa development of your stomatitis. So, ano yung mga drugs dito that will most likely put the patient at risk for the development of your stomatitis. Yung mga may plus na yan. Yan. So, for the rest of the table, please check page 534 of your reference material by Dow. Yan. So, next, you have your vinca alkaloids. For vinca alkaloids, it will include the following. Your vinblastine, vincristine, and your vinorelbine. So, ang target ng vinca alkaloids will be the M phase of your cell division. So, M here will stand for your meta phase. So, these drugs will bind to your microtubule protein, tubulin, forming now your mitotic spindles. So, mag-result yan sa tumor cell death. Yan. So, ito ulit yung table. So, ma-observe nyo dito, none of these agents will put the patient at risk for the development of stomatitis. So, detailed mode of action, ito ulit yung link. So, for the targeted anti-neoplastic therapy naman, so targeted siya. The idea is to target a specific molecular pathway in the tumor cell cycle originated from limitations of traditional anti-neoplastic drugs such as non-selective toxicity, drug resistance, and suboptimal success rate. So, ang target anti-neoplastic therapy, syempre, is targeting a specific molecular pathway in your tumor cells. Kaya siya targeted. So, samples ulit ng targeted anti-neoplastic drugs, you have the following. Yan. So, dito, familiarize yourselves kung ano yung mga indications niya. So, most ng indications will be the different types of leukemias. Yan, CML, chronic myelogenous leukemia, mga ALL, yan, mga leukemias. And syempre yung adverse effects. So for the implications for dentistry, you have the different oral complications of your chemotherapy. Kasi nga as previously discussed, ang most common na side effect natin ng chemo drugs natin in relation to your field will be the different oral complications. Yan. So the oral complications of cancer therapy may result directly either from the cytotoxic effects. So these are the direct toxic effects of the drug on the oral tissues, including your salivary glands, or will result from therapy involving distant tissues. So distant tissues, hence indirect toxic effects. So pag makikita nyo dito sa table, you have your direct toxicities focused on the effects of your chemo drugs on the oral tissues and like your salivary gland. And for the indirect toxicities, ang involved dito will be the distant tissues. So the high turnover rate of the oral mucosal tissues puts them at risk for the cytotoxic effect of the different chemo drugs. Kasi nga, ang target, again, ng chemo drugs natin will be rapidly dividing cells. And ang isang example dito will be your oral mucosal tissue. So for the direct mucosal damage, this may be accentuated by many factors. So salivary gland dysfunction, so it will compromise now the barrier and lubricating function of your saliva for mucosal trauma or irritation due to the medications and syempre mouth breathing for patients. So magkakaroon ng dryness dun sa oral mucosa. So infections caused by indigenous oral flora, especially the different opportunistic oral pathogens. Pwede rin mga acquired pathogens, and you have here the reactivation of your latent herpes virus. So yun yung mga organisms na pwedeng mag-infect sa oral mucosa ng isang patient undergoing chemotherapy. So for the direct oral toxic effects, so the terms oral mucositis and stomatitis were often used interchangeably in the past, but they do not reflect an identical process. So dapat alam niyo yung difference ng stomatitis with your oral mucositis. So for stomatitis, this is a more general term and is applied to any inflammatory conditions of the oral tissues regardless of the cause, including infections and autoimmune disorders. So it is a general term applied to any inflammatory process of your oral cavity. That's your stomatitis. For oral mucositis naman, this is applied to inflammation and breakdown of the oral mucosa resulting from damage caused by your chemotherapeutic agents or radiation therapy. So this is specifically caused by your chemo drugs and your radiation therapy or oral mucositis. So oral mucositis is the preferred term to represent the direct mucosal toxicity of your cancer drugs on the oral mucosal tissue. Yan. So for oral mucositis is a significant problem in patients receiving chemotherapy for solid tumors, and it has been reported in 20% to 40% of patients receiving conventional chemo. So oral mucositis is described to be very painful and can significantly affect nutritional intake, so mouth care and quality of life. So for patients with oral mucositis, so ang pinaka-chief complaint nila sa inyo syempre will be painful, very painful lesions. So hindi na sila makakain since very painful nga yung lesions nila sa oral mucosa nila. So in patients immunosuppressed because of chemo, increased severity of oral mucositis was found to be significantly associated with the following. So increased number of days requiring total parenteral nutrition, increased number of days with fever, incidence of significant infection, increased time in the hospital, and increased total inpatient charges. So all of this will result to an increased chance or increased severity of your oral mucositis. So for the management of oral mucositis, the management is currently focused on palliation of pain kasi nga it's very painful, so dapat relief of pain and efforts to reduce the influence of your secondary factors on mucositis. So according to this, the MASCC or ISOO they develop clinical practice guidelines for the management of your mucositis. So, ito yung important na table in your book. You have here the different agents studied for oral mucositis. So, andito yung mga agents. Yan, your agents and yung status nila based on the guidelines regarding the management of your oral mucositis. So, i-review nyo yung table na ito. So, ito yung mga agents natin ginagamit for management of your oral mucositis. So, it is your clinical guidelines. So, for other direct toxic oral effects, you have salivary gland dysfunction, neurotoxicity, alterations in the dental and skeletal growth, and development in your osteonecrosis of the jaw, related now to your biphosphonate therapy. So, for your indirect oral toxic effects, so the most important indirect toxicities are oral infections associated now with myelosuppression and immunosuppression associated with damage to your myelogenous stem cells. So, meron ng damage kasi sa bone marrow. So, your pre-existing oral and dental infections can spread with the oral cavity serving as the point of entry for organisms. So, ang problem dito is mas prone yung patient mag-develop ng additional dental infection or additional systemic infection din since ang point of entry dito will be your oral cavity. So, yung patients natin, cancer patients natin, if they have dental infections, this can spread via the oral cavity into the systemic circulation. So, other indirect toxic effects to the oral cavity are your thrombocytopenia, so decreased platelet, your anemia, and your GI toxicity. So again, yung mga toxic effects natin na ito, this is due to the action of your chemo drugs acting on the actively replicating or actively dividing cells of the body. So that ends our discussion for your cancer chemo. So kung mapapansin nyo, hindi na natin masyadong diniscuss yung specific na mga chemo drugs since sobrang dami nila. So ang important dito is for you to know under what class of agent they belong to. And syempre, yung mga important implications related to your field. And syempre, check nyo pa rin yung tables sa mga indications nila since kanina yung previous na sinabi ko sa inyo, some of them or most of them are used for in cases of leukemia, yung mga ganyan. So, for the laboratory period, please read on the other direct toxic oral effects of chemotherapy on the oral cavity as previously mentioned, and explain based on your own words the following. So, yung how that chemo drug results to do or how your chemo drugs results to that type of oral effect, and syempre, how will you manage that type of oral problem. And another, same then with your indirect toxic oral effects of chemo. So, read and explain based on your own words how chemo results to that indirect type of oral effect and syempre the management. So, ang gamitin yung reference since nandun na yung sagot for this, ang kailangan nyo lang is to read it and understand it and explain based on your own understanding yung questions asked dito sa nagagawin nyo for the laboratory period. So, yan. Ito yung other direct toxic oral effects. So, read on the following. And itong indirect toxic oral toxic effects. So, lahat yan nandun na sa reference book nyo by Dowd. So, please, ito yung read on this. Ito yung gagawin nyo for the laboratory period. Encoded naman siya, but no copy-paste since makikita ko lang din naman kung copy-paste since ang reference nyo nga is the book. So, don't search sa internet. Gamitin nyo yung book. Kung may search man kayo sa internet, maybe sa management if hindi siya mentioned doon sa book. So, ang deadline nito is 12 midnight. So, hindi siya 12 p.m. So, 12 midnight today. So, this topic will be included in your next quiz, in your quiz next meeting. So, if you don't have any questions, thank you for listening, guys.